Hello friends, it's me Needu. Welcome to my channel Helping Hand for Nurses. In this video, I am discussing some of the questions which were asked in Kerala PSC staff nurse examination. I have included some golden points also which will be helpful for all nursing exam preparations. So please watch the video till the end. And if you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. So let us start the video. Dilation of renal pelvis is known as options A. Glomerulonephritis, B. Pyelonephritis, C. Hydronephrosis, D. Nephrotic syndrome. Answer is C. Hydronephrosis. So dilatation of the renal pelvis is known as hydronephrosis. So hydronephrosis is a dilation of the pelvis and calyces of one or both kidneys because of the accumulation of urine resulting from obstruction of urine outflow. Nephrotic syndrome. It is a damage to the clusters of small blood vessels in kidney that filter waste and excess water from blood. It is a damage to the clusters of small blood vessels in kidney that filter waste and excess water from blood. And the main characteristics of nephrotic syndrome includes hypoalbuminemia, oliguria, edema, and hyperlipidemia. These are the characteristics of nephrotic syndrome. Glomerulonephritis is the inflammation of glomeruli, which are made up of tiny blood vessels responsible for excretion. And the classical signs of glomerulonephritis includes hematuria, hypertension, edema, and oliguria. Pyelonephritis, it is an infection of one or both kidneys, usually involving both the pelvis and functional tissue. Next question. Largest cranial nerve is options A. Trigeminal nerve, B. Olfactory nerve, C. Glossopharyngeal nerve, D. Hypoglossal nerve. Answer is A. Trigeminal nerve. So the largest cranial nerve is trigeminal nerve. Longest cranial nerve is vagus nerve. Shortest cranial nerve is olfactory nerve. Largest and thickest nerve is sciatic nerve. Thinnest cranial nerve is trochlear nerve. Largest cranial nerve is trigeminal nerve. So longest cranial nerve is vagus nerve. Shortest cranial nerve is olfactory nerve. Largest and thickest nerve is sciatic nerve. Thinnest cranial nerve is trochlear nerve. Largest cranial nerve is trigeminal nerve. Next question. Melatonin is a hormone secreted by options A. Thyroid gland, B. Pineal gland, C. Pituitary gland, D. Adenoid gland. Answer is B. Pineal gland. So melatonin is a hormone secreted by pineal gland. Next we can see some of the glands and the hormone produced by those glands, its function and regulator. First one is thyroid gland. The hormones secreted by thyroid gland includes thyroxine or T4, triiodothyronine or T3, and the function is increases oxygen consumption and heat production, stimulates, increases and maintains metabolic processes. Regulator. Thyroid stimulating hormone regulated by thyroid releasing hormone from the hypothalamus. Next hormone is a calcitonin, which is secreted by the parafollicular cells of thyroid gland. The function is inhibits calcium release from bone, thus lowering blood calcium levels. Calcitonin inhibits calcium release from bone and thus lower blood calcium levels. And the regulator is the blood calcium concentrations. Next, pineal gland. The hormone released by pineal gland is melatonin, and the function is It is involved in circadian rhythms. That is, this hormone modulates sleep patterns in both circadian and seasonal cycles. It also have an anti-gonadotropic effect, and exposure to light decreases the secretion of melatonin. Regulator is exposure to light and dark cycles. Next is posterior pituitary gland, and the hormone released by the posterior pituitary is antidiuretic hormone and oxytocin. The function of antidiuretic hormone is it increases water absorption from kidney and thus raises blood pressure. It increases water absorption from kidney and raises blood pressure. Regulator is hypothalamic secretions and blood osmolarity. Oxytocin stimulates contraction of the pregnant uterus. Regulator is hypothalamic secretions, uterine stretch and sucking. Anterior pituitary. The hormones released by anterior pituitary includes first one somatotropin. Somatotropin, or otherwise known as a growth hormone. It stimulates bone and muscle growth, promotes protein synthesis and fat mobilization. Regulator is hypothalamic secretion. Next hormone secreted by or released by anterior pituitary is prolactin. Prolactin promotes production and secretion of milk after childbirth. Promotes production and secretion of milk after childbirth, and regulator is hypothalamic hormones. Prolactin is otherwise known as milk producing hormone. Next hormone which is secreted by the anterior pituitary is thyroid stimulating hormone, and the function is production and secretion of thyroid hormones. Regulator, blood thyroxine levels and hypothalamic secretions. Next hormone secreted by anterior pituitary is adrenocorticotropic hormone. It stimulates adrenal cortex to secrete cortisol and other steroids. And regulator is a corticotropin releasing hormone from hypothalamus and blood cortisol levels. Anterior pituitary also releases luteinizing hormone in females and interstitial cell stimulating hormone in males. And the function is initiates ovulation and secretion of sex hormones in both genders. Regulator is hypothalamic secretions, estrogen and testosterone levels. Next hormone released by anterior pituitary is follicle stimulating hormone. It stimulates the development of ovum in ovaries and sperm in testes. And regulator includes hypothalamic secretions and progesterone. Next question. Route of administration of BCG vaccination is options A. Intradermal, B. Intramuscular, C. Subcutaneous, D. Oral. Answer is A. Intradermal. So the route of administration of BCG vaccination is intradermal. Next we can see some of the vaccines and its route of administration. So BCG vaccination, the route is intradermal. For measles and MMR vaccination, the route of administration is subcutaneous. DPT and hepatitis vaccination is usually given by IM injections, that is intramuscular. Sabin, that is oral polio vaccine through oral route, and influenza vaccine is through intranasal route. Next question. Kaposi sarcoma is common in options A. Hepatitis, B. Psoriasis, C. Dermatitis, D. AIDS. Answer is D. AIDS. So Kaposi sarcoma is common in AIDS. Next question. Geriatric medicine is a specialty that focuses on options A. Adolescent population, B. Female population, C. Elderly population, D. Male population. Answer is C. Elderly population. So geriatric medicine is a specialty that focuses on elderly population. Next question. ECG changes in cardiac ischemia is options A. ST segment depression, B. Physiologic Q wave, C. ST segment elevation, D. Pathologic Q wave. Answer is ST segment depression. So ECG changes in cardiac ischemia is ST segment depression. So ST segment elevation occurs in acute MI, acute pericarditis and Prince-Metal's angina. ST segment depression occurs in ischemia, hypokalemia and digoxin effect. Next question. The occupational disease caused by inhalation of cotton fiber dust over a long period of time. Options A. Bagassosis, B. Anthracosis, C. Silicosis, D. Byssinosis. Answer is D. Byssinosis. So the occupational disease caused by inhalation of cotton fiber dust over a long period of time is byssinosis. And the disease caused by the inhalation of the coal dust is anthracosis. Cane fiber bagassosis. Silicosis. Cotton dust byssinosis. Asbestosis. Tobaccosis. Iron cirrhosis. Hay grain dust farmer's lab. Next question. An epidemic outbreak of disease in bird population. Options A.Enzootic, B.Epornithic, C.Pandemic, D.Epizootic. Answer is B.Epornithic. So an epidemic outbreak of disease in bird population is epornithic. So epidemic, the diseases occurring in an area from a common source on a large scale. Epidemic is a diseases occurring in an area from a common source on large scale. For example, cholera. Next is the endemic. Endemic, that is the diseases which are present continuously in the community and never disappears. Diseases which are present continuously in the community and never disappears. For example, typhoid, malaria, etc. Pandemic. Diseases spreading quickly from one country to another. Pandemic, diseases spreading quickly from one country to another. For example, plague. Sporadic. Diseases occurring in an area at intervals as scattered cases. Sporadic diseases occurring in an area at intervals as scattered cases. For example, chickenpox. Zoonosis. Diseases transmitted from animals to man or from man to animals. Example, rabies. Epizootic. Epizootic, it is an epidemic in animals like rat. Example, plague. Enzootic. Endemic occurring in animals. Example, anthrax. Epornithic. An outbreak of disease in bird population. Example, avian flu. Next question. The concept public health was born in options A.Greek B.China C.Rome D. Egypt. Answer is C. Rome. So the concept public health was born in Rome. Next question. Father of Indian surgery. Options A.Charaka, B.Susrutha, C.Atraya, D.Varpada. Answer is B.Susrutha. So father of Indian surgery is Susrutha. Next question. First antipsychotic drug used in schizophrenia. Options A.Lithium, B.Amitriptylline, C.Chlorpromazine, D.Imipramine. Answer is C.Chlorpromazine. So first antipsychotic drug used in schizophrenia is chlorpromazine. So first antipsychotic drug is CPZ, that is chlorpromazine. First benzodiazepine is Librium, also known as chlordiazepocide. First tricyclic antidepressant is Imipramine. First antipsychotic chlorpromazine. First benzodiazepine chlordiazepocide or Librium. First tricyclic antidepressant Imipramine. Next question. Dread of high places is called. Options: A. Agoraphobia, B. Zoophobia, C. Claustrophobia, D. Acrophobia. Answer is D. Acrophobia. So dread of high places or fear of high places is called acrophobia. So agoraphobia, it is a fear of situation. Social phobia, it is a fear of activity. Acrophobia, fear of height. Zoophobia, fear of animals. Xenophobia, fear of strangers. Claustrophobia, fear of closed spaces. Algophobia, fear of pain. So these are some of the phobias. Next question. The hyperpigmented patch on the cheeks and face of the pregnant woman is known as. Options: A.Chloasma B.Palmer sign, C.Snow D.Hegar sign. Answer is A.Chloasma. So the hyperpigmented patch on the cheeks and face of the pregnant woman is known as chloasma. Next question. The HCG level in normal pregnancy reach a peak in. Options: A. 60 to 70 days, B. 20 to 30 days, C. 40 to 50 days, D. 0 to 10 days. Answer is A. 60 to 70 days. So HCG levels rise 8 days after ovulation, peaks at 60 to 90 days and then lower slightly. HCG levels rise 8 days after ovulation, peak at 60 to 90 days and then lower slightly. Next question. A specific type of imaging that uses a low-dose X-ray system to examine breast. Options: A. Angiography, B. Cholangiography, C. Mammography, D. Bronchography. Answer is C. Mammography. Angiography, it is the X-ray study of the blood vessels. Angiography is the X-ray study of blood vessels. Angiogram uses a radio-opaque substance or dye to make the blood vessels visible under X-ray. Arteriography is a type of angiography that involves a study of arteries. Cholangiography, it is the X-ray examination of the bile ducts used to locate and identify an obstruction. Bronchography, it is a radiographic visualization of the bronchi and their branches after injection of a radio-opaque substance. Next question. Inflammation of the cornea is called. Options: A. Corneal ulcers, B. Keratitis, C. Uveitis, D. Blepheritis. Answer is B. Keratitis. So the inflammation of the cornea is called keratitis. Keratitis is a corneal disease that is characterized by inflammation of the cornea. Blepheritis is one of the most common ocular conditions characterized by inflammation, scaling, reddening and crusting of the eyelid. Inflammation, scaling, reddening and crusting of the eyelid. Uveitis, it is the inflammation of the uvea, the pigmented layer that lies between the inner retina and outer fibrous layer, composed of sclera and cornea. Uveitis is the inflammation of the uvea, which is the pigmented layer that lies between the inner retina and the outer fibrous layer. Uvea consists of the middle layer of pigmented vascular structures of the eye, and it includes iris, ciliary body and choroid. Corneal ulcer. Area of epithelial tissue loss from corneal surface associated with inflammatory cells in the cornea and anterior chamber. Area of epithelial tissue loss from corneal surface associated with inflammatory cells in the cornea and anterior chamber. Next question. Hearing loss associated with aging is known as. Options: A. Meniere's disease, B. Otosclerosis, C. Labyrinthitis, D. Presbycusis. Answer is D. Presbycusis. So hearing loss associated with aging is known as presbycusis. So Meniere's disease, it is a disorder of the inner ear that is characterized by episodes of vertigo, that is feeling like the world is spinning, and tinnitus, that is ringing in the ears, hearing loss and a fullness in the ear. So Meniere's disease is a disorder of the inner ear that is characterized by vertigo, tinnitus, hearing loss and fullness in the ear. Otosclerosis, it is a hereditary disorder causing progressive deafness due to overgrowth of bone in the ear. Labyrinthitis, also known as vestibular neuritis, it is the inflammation of the inner ear. Presbycusis or age-related hearing loss, it is the cumulative effect of aging on hearing. It is a progressive and irreversible bilateral symmetrical age-related sensory neural hearing loss resulting from degeneration of the cochlea or associated structures of the inner ear or auditory nerves. So presbycusis, it is an age-related sensory neural hearing loss, and it is progressive and irreversible, bilateral and symmetrical, and it occurs as a result of the degeneration of the cochlea or associated structures of the inner ear or auditory nerves. So friends, these are some of the questions which are asked in the previous Kerala PSC staff nurse exam.